If you're doing this for your trigger finger or your trigger thumb, then you need to stop right now. Hey guys, I'm Michelle from Virtual Hand Care, and in this video, I'm gonna share the worst exercise for trigger finger or trigger thumb. And I'm gonna show you what to do instead. So one of the worst exercises you can do for trigger finger or trigger thumb is repetitive squeezing or repetitive gripping with a ball or without a ball. And the reason for that is because trigger finger is what is called stenosing tenosynovitis. This is basically inflammation of the sheath or the covering that surrounds the tendon of the affected finger. So of whatever finger is triggering. So that's a lot of swelling in a little space along your tendon. And when you go to flex or carry items, grasp or open jars, things like that, that area that is swollen has to move through a very tight space known as your pulleys. So we have several pulleys all along our fingers. And if the tendon is swollen and it is inflamed, or the area has developed some scar tissue, you now have an area on that tendon that is too big for the space that it has to pull through. And not to mention, we're already gripping a ton during the day anyway. You're squeezing the toothpaste, your grip around the refrigerator and open the refrigerator door. There's so many things that you're already doing that is including gripping. And don't you think that if you were gripping and squeezing things all day at home or at work, that it would make your trigger finger better? Probably not. So why is it that most people are told or recommended to just squeeze a ball to get rid of trigger finger? It's a very repetitive type of movement that is only going to contribute to further inflammation and aggravation of that tendon. And not to mention, there's no research proving that squeezing a ball is an effective exercise. So what can you do instead of gripping a ball? Well, you can do an A1 pulley stretch. I know what you're thinking. What? What did she just say? Hear me out. So research shows that you can actually stretch out that pulley by doing an isometric contraction of your FDP tendon. That FDP tendon is the tendon that is responsible for getting stuck down here at your A1 pulley. So by applying a contraction to that tendon, it will help stretch your pulley out. And if your pulley is stretched out over time, that will allow more space in there for your tendon to glide and move. And therefore, when you're gripping items and using your hand, you won't trigger. And the less triggering that happens, the more that inflammation can get out of there and the more healing that can occur of that trigger finger. So how do you do an A1 pulley stretch? So you're gonna wanna grab yourself a washcloth. Now, in this research article, it states that you must place the triggering finger at about 45 degrees of flexion at the knuckle only. So I'm gonna go ahead and demonstrate this on my middle finger, but you're gonna wanna do this on whichever finger is triggering for you. So what you wanna do is you wanna roll a washcloth up, place it behind the middle finger so that your middle finger is up at a 45-degree angle, but the rest of my finger is straight. So what you want to do then is apply pressure to just the tip of your middle finger or whichever finger is triggering. And you want that finger, that middle finger, to resist that pressure. Hold that contraction for a good 5 to 10 seconds. You'll see a little contraction of that whole tendon all the way down, even into your palm. And you might even feel it kind of in that pulley area where you've been feeling some of that triggering and that tenderness. And then you would relax. And then you would go ahead and repeat that again. Hold for 5 to 10 seconds or so. And you would want to repeat that 10 to 20 repetitions a couple of times a day. And then you could do this exercise on your thumb. And so for the thumb, we're looking to apply a contraction to the FPL tendon, which will help stretch out the oblique pulley. That's the pulley that is responsible for trigger thumb. So to do this exercise, you would then just rest your hand down Bring the thumb a little bit more across the palm, and you're going to apply pressure just to the tip of the thumb. Hold that contraction for 5 to 10 seconds, and then you're going to relax that. And again, you would repeat that, making sure the tip of the thumb doesn't bend at all. And then you would relax, and you would repeat that about 10 to 20 repetitions as well, a couple times a day. Now, if you found this video helpful, do please give it a like, and don't forget to hit that subscribe button below. Keep in mind, there are many other really good exercises that you can do instead of gripping a ball. So do check out my top 5 trigger finger treatment video, and I'll link that here. Thanks for watching.